This is Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. I'm so pleased today to present a podcast on the topic of clinical and statistical significance. And this particular podcast is based on an article that will be appearing in one of the issues of our journal. The presenters today are Dr. Jamie Zoellner and Dr. Jeff Harris. Dr. Zoellner is a professor in the Department of Public Health Sciences at the University of Virginia, and Dr. Harris is also a professor in the Department of Nutrition at Westchester University. Both are a part of our stats team for the journal and have contributed numerous articles already to our journal that has really been a marvelous asset to instructors in the field of nutrition and dietetics. And I think does a marvelous job of enhancing course syllabi as we are teaching nutrition and dietetics students. I personally use their articles in all four of the courses that I teach. And as this particular article is focusing on significance, that has really helped our students to a great degree in terms of understanding topics that can be quite complicated in terms of statistics. So Jamie and Jeff will be responding to questions today on this concept of significance. And I'm going to start with Jamie. Your article on effect size, which I have already said will be appearing in an issue of the Journal of the Academy of Nutrition and Dietetics, discusses the importance of achieving significant results when we are doing research. And so the question is, why is statistical significance so important when reviewing the final outcomes of studies?
Sure, thanks, Linda. I'm happy to take that question. I appreciate you inviting Jeff and I to the podcast today. We worked really hard on this manuscript, and we're really thankful to have this podcast as a venue to talk through some of these questions. So your question around statistical significance and why is it important to the outcomes of a study? Well, in a nutshell, achieving statistical significance is important because it informs the ability to reject or to fail to reject the null hypothesis. You know, we all can appreciate that good research starts with well thought out research questions and a statement of the null hypothesis. Just as a quick reminder, simply put, a null hypothesis would state that there is no significant differences, for example, between two conditions. When I teach this to my students or my staff, I typically think about reminding them, remember that the null hypothesis is like saying the nothing hypothesis. You hypothesize nothing is going to be different. And so typically we set out to reject this idea. We want to reject that nothing is different, or that the null hypothesis, that there's no significant difference. So let me just entertain you for a minute and take you through one of the examples that we use in the paper, because I think this is probably the best way to shed light onto this a little bit more. So, for example, one of the examples we use in the paper is a research question around the effects of a ketogenic Mediterranean diet compared to a traditional Mediterranean diet on LDL levels among Hispanic females. So to state the null hypothesis would to say that there's no statistically significant differences in LDL cholesterol between those two conditions. So we set out in terms of thinking about the statistical significance, we set out to try to reject that, right? So it's all based on probability in terms of trying to reject the null hypothesis. So, typically that level of statistical significance is chosen as 0.05 or 5%. So in this example, if the designated cutoff is below or less than p equals 0.05, then that would imply that it is statistically significant. And so I know this can be confusing sometimes. I hope that's helpful. I do want to point out that this idea around statistical significance, it's, typically we see that it's 0.05 is the threshold that we would set to fail to reject the null, but sometimes it can be 0.01 or 1% or 0.10 at 10%. But understanding statistical significance is important because it helps us know if we can reject or fail to reject the null hypothesis.
Thank you. Very nicely stated. My second question then goes to Jeff. There are differences between statistical and clinical significance. And I wondered if you might tell us a little bit more about what those differences are.
Okay, and as Dr. Zoellner said, I'm very thankful to be on this call, and it's great working with the statistical team. So here's my answer. Statistical significance is an objective mathematical comparison to a statistical threshold. Typically, a statistical test is done yielding a test statistic like a t-value, an f-value, or an r-value, and a p-value is generated. And for those of you who've had basic statistics, you would be familiar with these test statistics. And as Dr. Zoellner said, a p-value of 0.05 is set as a threshold typically. And if the p-value is less than 0.05, we deem the result statistically significant. If equal to or greater than 0.05, we conclude the results are not statistically significant. Statistical significance is affected by sample size. Studies with small sample sizes make it harder to achieve a p-value less than 0.05. Large sample sizes make it easier to achieve statistical significance. Let me give you an example. Suppose we have a study of a 26-week weight control approach. We take a large group of overweight people and in several geographic locations, we expose them to the weight control program. So we measure their weight before the program and at the end of the 26 weeks. So in this case, we would run, those of you who have had statistics, we would run a paired t-test to compare the before and after values. And suppose the sample size was large enough that an average of a 5-pound weight loss achieved a p-value of 0.03. We'd conclude from that a 5-pound average weight loss was statistically significant. So this is now where the concept of clinical significance comes in. Clinical significance has to do with whether the results of a study supply a true benefit to the people in preventing or treating a disease. It's about impact, such as is the person's disease burden being reduced? So for our example, we have to ask the question, is an average of 5-pound weight loss for a 26-week program beneficial to people? Studies show that a 5 to 10% weight loss is a threshold for chronic disease risk reduction. So from a clinical significance perspective, the results of our study do not reach this threshold. Also, is the investment of a person's time and resources for 26 weeks worth a 5-pound weight loss? So evaluating clinical significance has both objective and subjective components. So studies might yield statistically significant results, but these results might not provide a true benefit to people from a chronic disease risk reduction standpoint. When determining clinical significance, we have to consider a much greater number of parameters than simply p-values. For clinical significance, we have to consider parameters such as effect size, confidence intervals, and results derived from reviews of literature as to the magnitude of the effect that benefits people. So in conclusion, what we can say is a study might yield statistical significance, but in terms of the results of that study and the outcome, it may not be an impactful outcome. It may not be an outcome that rises to the level that relieves people's misery or prevents or treats their disease.
Thank you, Jeff. So important. And I know that many of the studies I work in would focus on clinical significance as a very important piece to what the data is actually showing. So thank you for that explanation. And Jamie, a third question, why should a practicing dietitian care about clinical significance?
Yeah, I think this is such an important question. I think, discerning clinical significance is probably one of the most important and one of the hardest things that we do as dietitians. There are so many different research papers out there. They're very often talking about the statistical significance, but sometimes this idea of clinical significance doesn't really come through as much as we would like for it to, or the authors don't put the emphasis on this clinical piece as much as we might like for them to. And Jeff just stated it so eloquently in terms of kind of the working definition of clinical significance. But I think, one of the reasons that practicing dietitians should care about clinical significance is because research papers, research questions that have both a statistically significant improvement as well as clinical significance are those that are actually influencing the way that we provide care and the way that we provide recommendations. We don't want to be changing our clinical practice or community-based practice based on statistical significance alone, because as Jeff mentioned, it might have a very small impact. It might not be worth the amount of dollars, or it might not have a sustained effect among consumers. And so really trying to navigate through that, I think, is really important. I really like the idea that Jeff used around this idea with weight and sort of what is a clinically significant difference in weight. One of the terms that we bring up in our paper is this idea of a minimal clinically important difference, or MCID. And the reality is that even this can be really hard to discern sometimes. The 5 to 10% threshold on weight loss is something that's pretty well established in the literature. But, one of the things that I do as really a public health science researcher is try to think about the scale up of interventions at a population level. And for me, sometimes even seeing benefits as low as 2 or 3% on a population level might be clinically important in the line of work that I do, even though that might not be as clinically important for someone who's doing more one-on-one medical nutrition therapy. So you can see that this is really quite a complicated topic, and there's lots of layers that come into this. But, for the listeners, I think the one thing that I would challenge them to do is, within their network of peers, is to have these conversations with their peers and other dietitians that surround them. And, one of the things when I'm working with my students and staff, when they come to me so excited that their p-value was significant, I always stop and say, so what? Tell me why this is important. Break it down to me. Tell me how I'm going to describe to my colleague or my peer why they should use your paper to change what they're doing in practice. And that really helps generate a lot of healthy discussion on this whole idea around clinical significance. But it's not a one size fits all. There's no magic number. There's no magic threshold. It's really sort of specific to the particular situation, the particular geographic region, the demographic group, the list goes on and on. So,
yes. Thank you so much for clarifying and bringing up the point that when we look at public health, and large populations, we may be looking at things a little bit differently. And that, again, along with all of the other caveats that that you indicated are incredibly important as we look at significance. And then finally, Jeff, when a study does not reach the significance level, is that study still important in the world of research? And then additionally, what might next steps be as future research plans are being designed?
Well, this study can be important, even though it doesn't reach statistical significance. Suppose a study was done with small sample sizes, which makes it very hard for results to reach that statistically significant level. Let's say a study was done on the effect of low-dose potassium supplements on blood pressure in those with high blood pressure, with the blood pressure measured before and after the study. And suppose it was done in a very small sample. And then let's say the potassium supplementation led to a 7/5 millimeter of mercury reduction in blood pressure on average with a p-value of 0.20. And we know that 0.20, since it's not less than 0.05, we would deem that not statistically significant. But of the people participating, let's say 70% achieved a blood pressure of 120/80 or lower, which is really the goal of blood pressure reduction. That's quite remarkable considering the results were not statistically significant. Also, suppose that 95% confidence intervals, a 95% confidence interval was constructed based on this data, and the results range from an elevation of blood pressure of 2/1 to a reduction to 12/10. So this tells us that some people had a dramatic reduction. Even though it didn't reach statistical significance, the results, we know from this range that there were some people that had very, very significant reductions. So what we learned from this is we would conduct studies with a larger sample size, and maybe with more control of confounding variables, and then a narrower subject characteristic pool. Because if we can find out from the small study the characteristics of those with a dramatic reduction, that means that then in subsequent study with a larger sample size, we can go out and be more narrow in our selection of our samples to do it, so that we take those people with the characteristics that had the dramatic reduction and we could include them in the study and then see what happens with potassium supplementation. So yes, these studies are very important, and I know a lot of students who are doing research projects will come back with a hangdog face, and they'll say, I conducted my study and it wasn't statistically significant, and they're depressed, they're down, they feel like they failed. But again, evidence-based practice and interpreting all of this is really not only looking at stats, but it's also looking at things like clinical judgment. So if they go back to their study and they look at the nuances and they're able to use more parameters to look at the results rather than just statistical significance, they may be able to mine from that study useful information that can be used in subsequent studies. So in conclusion, yeah, all studies are important, but you have to dig in more deeply than typically looking at statistical significance.
So some of what you're saying too is that some of these preliminary studies may send us in the direction of different inclusion exclusion criteria, and that then in the long run may lead to studies that are very definitive, giving us statistical significance, clinical significance as well, and then outcomes that are very meaningful.
Yes, yes.
Okay, well, thank you both so much for responding to my questions. And I so appreciate your sifting out for us the importance of significance, but then also helping us to understand more clearly how important that clinical significance is and how important it is as we work in clinical settings and try to use research that might be of value in clinical settings where we work. So thank you so very much. And my appreciation for your participation in this podcast.
Thanks, Linda.
Thanks, Linda.
Thank you.